elevating the ER has been a big focus of MUSC here in Orangeburg, and it's probably the number one thing that we heard coming into the community when we would go out and talk to the community. First thing I would hear is, you got to get the ER better. And part of it was service, part of it was crowding, part of it was people didn't feel like they were treated in the right way, or where they were turned away. So that's been a big focus, and trauma is an extension of that. Because trauma comes in through the ER. Orangeburg had some tough years during COVID. I mean, granted, it was some tough times, but one of the decisions made was that they were not going to offer a certain level of trauma care. That was a decision made prior to, and for a lot of different reasons, and I completely understand it. Part of it's financial, part of it's an ability to recruit physicians. We came in, and before we even took over, we decided we're going to reinstitute level 2 trauma here in Orangeburg, because it actually would help us in downtown Charleston. Those patients are going to have to go somewhere, right? You can't ignore that. So we're reinstituting level 2 trauma here in Orangeburg.
Orangeburg is I think a work in progress from our perspective, but we're making huge gains. And I personally believe that where we will be together as a community and in partnership will be not recognizable in 10 or 20 years. I just think there's so much upside. So we're digging in hard. We're working to get a lot of what you're hearing is basic blocking and tackling stuff, but you have to have a basis to build things forward. Educationally, there's programs, the psych program as an example. There's huge, in every regional division, including here in Orangeburg, we're working with the technical colleges to try to figure out creatively what we can do to get better pipelines, better awareness, creative programs. We'll hire anybody, almost instantly at the tech level, as long as they have appropriate training, and yet there's this disconnect between A and B and C. So we're, it's really leaning in with those partnerships in terms of what we can do that will have a longitudinal impact. Most technical and nursing students, and ultimately those individuals, ideally want to grow up, live, and have the opportunity to be a part of that community. Those are more local, regional people, right? You don't travel necessarily from New Jersey. Not that they can't come, but you really have an opportunity as somebody who grew up in that community to be a part of that if you want to be a part of healthcare. So we're creating new opportunities across every division with every technical college. The details are slightly different in terms of what they're doing. So all those pieces and parts are moving. We won't say job's done, but hopefully you're hearing and seeing that, and not just what we're saying, but the reality of what is within the community and what we're actually delivering is a healthcare system here with your community, that there is a shifting and very positive reality.
We feel very positive about Orangeburg, and in some ways this is probably of all the hospitals that MUSC has acquired in the last 5 years, this is the one we've got the fastest start. If you remember, the year before we took over, this hospital was losing almost $30 million per year, and we're at about break even right now. And that's not with MUSC, just throwing money over the fence in order to close that gap. I mean, that's Dr. Cole's point. A lot of blocking and tackling, investment. There is investment in computers and equipment that we found had to happen, and then recruiting. So we feel very, very good about where Orangeburg is headed. Job's not done. We find it takes about 3 years to get into a very stable situation, just based upon other hospitals that we've acquired, and so we're just a little more than a year in.